For everybody listening, you send Capsule on a cancer patient and the scar because that's the most likely place you're going to have cancer again.
I don't think people understand how unique what you're doing is. And for example, most of the surgeons, when they remove an implant, they're not testing them. They go, oh, they look fine. And they just get rid of them. That's it. They don't test them. They don't even swab them.
He was trained to do reconstructive surgery as why I was. And it would have been heresy for me to ever take out a cancer patient's implant and capsule, not send it. For everybody listening, you send Capsule on a cancer patient and the scar because that's the most likely place you're going to have cancer again. Send the scar, and then we sent swabs because I was doing. I mean, that was standard of care to me.
That was not protocol. That was exceptional protocol.
She had an E. coli infection, and so for everybody listening, E. coli is found in the gut and found in the urinary tract. And that's not supposed to be found around implants. And so going back, I was like, how did I miss this? I had taken care of thousands of patients over, my career, which started in '04 with, plastic surgery. And I was like, how on earth did I miss this? And I went back through all the labs and, studies. And I was like, I don't know how I missed this. Her only symptom, she complained of fatigue, which, I mean, honestly, in my training and people who've gotten chemotherapy and radiation therapy and bone marrow suppression, that was kind of universal that they had problems with fatigue. So
Very common.
I didn't think anything about that. And then she came back with an E. coli infection that I then treated, with an oral antibiotic as it was sensitive. And, within, the next week or two after treatment, and she had an explant, of course. Well, all of her fatigue went away.